Eat, sleep, selfie, repeat. Growing up in Warwickshire with social media. Social media is a part of life, especially for young people. Almost 90% of our young people use social media. National studies show the effects of social media can be both good and bad. This report wanted to understand the impacts of social media in Warwickshire and make recommendations to build on the positive impacts and address and reduce the negative. We surveyed over 2,000 Warwickshire young people. This is some of what they had to say. There were 5 big themes coming out of the research and some important messages with them. Well-being, identity, lifestyle, relationships, fear of missing out. Well-being. 60% told us that, overall, social media has a positive impact on their well-being, with nearly 70% using it to connect with their friends and find support. However, 5% of young people often feel worried about social media, and 46% of young people felt occasionally or often angry because of it. Identity. 51% told us that they did not feel under pressure to look better or perfect in pictures. However, 28% of young people did feel under pressure to look perfect. However, 54% of young people reported social media helps them be more creative. Lifestyle. In our survey, 26% of young people have made healthier lifestyle choices because of social media, and 44% said they were inspired to be more active by what they saw on social media. 58% of young people did not think the amount of time they spent on social media impacts the amount of physical activity they do. Relationships. 91% of young people agree that social media helps them keep in touch with friends. However, 30% of young people said they have experienced cyberbullying. 61% of young people said they often experience friends sending kind messages to them. And 68% said they would stick up for a friend if they saw them being bullied on social media. Fear of missing out. 43% of Warwickshire's young people said they check their phone as soon as they wake up, and 21% said they check their phone if they woke up during the night. 31% agrees social media impacts on the amount of sleep they get. Although most young people felt safe online, worryingly, over 30% said they were not sure if they felt safe. Also, 13% have had a stranger ask them for inappropriate images. Recommendations. Social media can improve access to physical and emotional health and well-being information. Social media can be an essential and useful tool to engage with young people. Tackling the resilience of young people in a social media world is urgent. It is all our responsibility, including schools, parents, all of society, to support young people to be resilient to the negative impacts of social media while maximising the positive impacts. We need to take account of the influence that social media can have on promoting healthy lifestyle choices, including getting enough sleep, being physically active, and having a balanced diet. Social media can influence relationships in both a positive and negative way. Social media dependency may be detrimental to health and well-being. For more details about the results of the survey and to hear the voice of Warwickshire's young people, find the full report and more information at publichealth.warwickshire.gov.uk/annual-report.